Federation. Let's bring Dr. Vivek Trivedi, co-chair of the Junior Doctors Committee at the British Medical Association. Vivek, good to speak to you. Thank you for joining us this afternoon. Could we start with that 35% figure? How has that been calculated? And when Wes Streeting says it's unrealistic, I wonder what you would say in response. Good afternoon.
Thanks for having me. So that number basically is to reverse the pay cuts that doctors have faced in real terms since 2008. So since 2008-2009, doctors have faced a more than 26% real terms pay cut. So a doctor, like for like, compared to their equivalent counterpart in 2008, is 26% less off. Now, to uplift back to net neutral, you actually have to add on more because you're starting from a lower number. So that 35% uplift is just to reverse the 26% real terms pay cut that we've had over the last 15 years.
And what you're asking for is that 35% in one go. That's not a sort of cumulative amount over the coming years. That is what you want now.
So that's the conversation that we're trying to have with Steve Barclay. And that's what, we've put our opening ask onto the table when we met with him on Wednesday. But he was unable to give us anything back. We want to have this dialogue and we want to be able to negotiate. But when he doesn't even give us an offer back, it's hard to think what he might be up to there.
What response have you had from him? What are they saying to you in private, Vivek?
So nothing more than what he's released in his press release. He told us that he thinks it's unreasonable. And when we asked him what would he be prepared to offer or what does he think is reasonable, he didn't give us anything. Nothing. No offer at all. And all we've wanted is a credible offer to put to our members so that we can come to the end of this dispute, because we don't want this to drag out. But when he gives us no offer at all, it's hard to move forward then.
It sounds to me like you're saying the 35% is what you would like, but you are willing to accept something lower, potentially quite a lot lower.
So what we're looking for is to restore the pay that doctors have lost. And that comes in a variety of forms. And like we said to Steve Barclay, we've said otherwise, we're willing to negotiate on how we get to that. But that's exactly what it is. It has to be a negotiation, which he's still yet to do.
We were hearing just a moment ago about the massive impact these strikes are going to have, and I know that's won't be as a surprise to you, and it is difficult for NHS staff when they decide whether to walk out or not. The allegation that you've decided intentionally not to protect things like emergency care and cancer treatment, is that correct? And if so, why was that decision made?
So junior doctors have called for a full withdrawal. So we've called for a full withdrawal of junior doctors. But importantly, there are other doctors, like consultants, specialty doctors, and other doctors who would not be going on strike, who, through local agreements and arrangements with their employers, would be able to cover us. Now, that's what we saw in the previous strikes, the 72 hours ones, where emergency care, cancer care, those, urgent, time-critical sectors of healthcare were still maintained. And that's what we would envisage going forward. But we need to do something to bring Steve Barclay to the table. It took us more than 150 days of our dispute for him to even write to us. And then we had a set of strikes hoping that would be enough to have an honest and open dialogue. But for him to then not give us an offer at all really puts us in a difficult position because, like I mentioned, we don't want to have to go on strike, but we also want to try and work towards a resolution.
But wouldn't you be more likely to get him round the table if you started off from a position that was perhaps a little bit more realistic in terms of what you're going to get? You're not going to get, Vivek, I think everyone knows this, you're not going to get a 35% pay rise. If you went to the health secretary and said, look, we want 15 or 20, but we're willing to discuss it, wouldn't that be more likely to deliver a positive outcome than the way that you have gone about it?
So, I hear that it sounds unrealistic or unreasonable for this 35% uplift, but I don't think anyone would agree that I don't think anyone would disagree that it's unrealistic and unreasonable to have a 26% pay cut, but that's what we've had. So that's why it sounds like a big number to uplift it, because we've had a big number taken away. But, for the latter part of what you asked, that's exactly what negotiations are about, and that's what we've been wanting to do. So it's just a shame that we're still having to call for more strikes to get to that position. I wish you would just come to the table and have a chat with us.
Very good to speak to you. Thank you for joining us. Really appreciate your time, Dr. Vivek Trivedi there, co-chair of the Junior Doctors Committee at the British Medical Association. Got to say, I think his point about Steve Barclay to some extent is sound. It has taken far, far too long for the Department of Health. Far too long for them to even start trying to sort out these strikes. They're now making some progress in other areas. It should have been done months ago. But I wonder if you agree that they are not unreasonable or unrealistic in asking for a 35% pay rise. Or do you think Wes Streeting from Labour, who says it's not unreasonable, but it is unrealistic, has got this one right. 0345 6060 973. Your call's next. It's fine.